Many thronged Banadir Hospital in central Mogadishu for voluntary testing for HIV. This year's HIV/AIDS Day theme in Somalia was Bridging the Gap after new figures showed an increase in new HIV infections. The rise in infections is being blamed on ignorance, cultural barriers and fear of stigmatization, which hamper many people from finding out their HIV status. Dr. Mahamud Mohamed, head of Banadir Hospital, which is one of the only two voluntary counseling and testing centers (VCT) in Mogadishu, says a hospital is currently treating 300 HIV and AIDS patients for free. She urged Somalis to know their status and encourage them to openly discuss the disease so that more people can know about it.
We are doing some activity to improve our quality of care and to know even the status of the Somali people.
According to statistics from the Somali National AIDS Commission, Somalia has a total of 26,000 people living with HIV and AIDS, with 51% of them being women. This figure includes those living in southern Somalia, Puntland and Somaliland. In 2013, 2,691 new cases were reported in south-central Somalia alone, while 980 were reported in Somaliland and 278 in Puntland. As part of this year's campaign, the youth are being targeted with some 200 university students from Somalia University and Jazeera University between the ages of 19 and 23 receiving free screening at Banadir Hospital. In Somalia's conservative Muslim society, HIV/AIDS is associated with promiscuity and issues of sexuality are rarely discussed.
I think the first reason is because there are cultural barriers. For example, they believe they are HIV negative simply because they do not engage in sexual behaviors. You hear everyone telling you, do not have sex, and they even feel ashamed to go for the HIV test. These cultural traits therefore make this disease not mentioned, and that is why I think it has silently spread.
After 2 decades of civil war, Somalia's health system is in tatters. Like Banadir, most hospitals in the country receive no government support and are funded by local and international aid organizations. Treatment of HIV-positive patients was only rolled out here in 2005. HIV/AIDS was discovered in the late 1990s. Dr. Mohamed believes that increased awareness could address issues related to HIV/AIDS, such as stigma, especially amongst the youth.
We are testing more than 200 students to know their status and also to emphasize that the HIV test is a normal test like HB or CBC or something like that, or hepatitis.
Sara Ahmed is a mother of 7 who is living with HIV.
I contracted the disease in Mogadishu from my husband, who was married to another woman. He infected me when he came back to Mogadishu from the other woman. After I realized, I went for a HIV test in the hospital and was referred to Banadir Hospital. That is how I started taking medication.
Like many who fear stigmatization, Ahmed was apprehensive about getting tested. She found out her status 7 months ago and is now urging Somalis to get tested, especially newlyweds, before exchanging vows.